So people with severe chronic headaches, what are you doing?
Well, it's kind of a pet peeve of mine because a lot of patients come in and I have migraines. And migraine is a very specific diagnosis, but there's many other types of headaches. So one of my job is to actually diagnose you properly so that we can treat you properly. But yeah, occipital headache, most of the time it's actually a neck problem.
What is occipital headache?
Oh, sorry, headache in the back part of your
Back
head.
of the head.
Yeah,
Okay.
so it's the pain that comes from here, goes all the way up, and probably some of your our listeners will be saying like, oh yeah, I get that pain, or towards the ear.
Is that an easy one to fix for you?
That's so easy to fix.
Really?
And the patients respond almost immediately.
What do you do?
We turn off the occipital nerve. We block it, we take the swelling. I mean, first we identify why the occipital nerve is swollen, but then we just turn it off.
And it's that simple.
That simple.
And the headaches go away and how long does that last? Could it last?
It's variable, 6 weeks to 3 months, and we can keep repeating the treatments. And
Okay.
I mean, these are patients that have lived their lives with a headache, and now they get 3 months of relief. It sounds like a little change, but for them, it's life-changing.
Yeah, everybody knows what it's like to have a headache. You're not in the mood for anything.
Exactly.
So what other type of headaches do you treat?
The occipital headache, we face pain, so facial pain from trigeminal neuralgia or from a ganglion called sphenopalatine ganglion pain. So those two types of
facial pain.
Facial pain, exactly.
Okay. But migraines, what if it is by definition a real migraine? Can you work with those people?
Yes, absolutely. So we diagnose that it's a real migraine. We have medications to abort the migraine, meaning you get a migraine headache, you either spray something on the nose or take a pill and goes away. And we have preventive medication as well, which is what a lot of patients don't know about. Like, oh, is there medication to prevent the migraine headaches? Yes, there are. And hopefully we can prevent them from happening.
Are there a lot of side effects with this?
There are some side effects, so that's why if the migraine is rare, we use an abortive treatment, meaning a medication that you use to stop it. Exactly. But if it's a very frequent thing, then the side effects are going to be negligible compared to the quality of life improvement of not having a headache.
So a person with a migraine, have you had people that now they're gone for good? As long as they keep up with the treatments?
Yeah, exactly. So they have very rare sporadic headaches, as long as they keep their preventive medication. So yeah, migraine is one of those that will linger, and identifying the triggers, which most of the patients with migraine will know about them.
Now the people with migraines, right? I mean, a legitimate migraine, don't they know all this stuff?
Unfortunately, no, because most of the time it's being treated by the primary care doctor.
Just giving the medications over the...
Yes, exactly. So
Okay.
but that's where the awareness about interventional pain specialists is so important.
And it doesn't cost more. I mean, with insurance, they're dealing with their primary care physician. They should be dealing with a specialist,
Correct.
right? But most people don't, right? They don't ask to see an interventional pain doctor.
Because they probably do not know about it.
How do they call you by name? Could they? And like you say, you don't need a referral, but they're called interventionalists. What are you guys called?
Yeah, a pain specialist is the
management
most
specialist.
common. Yeah, but try to ask your doctor to refer you if you want to be referred, or research about an interventional pain specialist. So look into the list of services, make sure it's board certified, and that offers alternative medication to medications.